Dehydration. The best treatment options. How to treat dehydration. Adequate water is essential for health and vitality. Dehydration happens when you do not replace the water in your body that is lost throughout the day. Dehydration can be caused by exercise, illness, or simply not drinking enough water. Understanding the signs and knowing how to react are essential for good health and recovery. You can usually treat mild to moderate dehydration on your own. However, if you have severe dehydration, you should seek immediate medical attention. Assessing the situation. Know who is most at risk for dehydration. Very young children, the elderly, and people who suffer from chronic illness are at the highest risk of dehydration. However, other groups are also at higher risk. Children's bodies are made up of more water than adults, and children's metabolisms are higher than adults' metabolisms. Children often experience vomiting and diarrhea as part of childhood illnesses. They may also not be able to understand or communicate when they need fluids. Older people may not experience thirst sensations as regularly, and their bodies do not conserve water as well. Some older people may also have conditions, such as Alzheimer's disease, that make it difficult to communicate their needs to caregivers. People with chronic illnesses, such as diabetes, heart failure, or kidney disease, are more likely to become dehydrated. People may also take medications that contribute to dehydration, diuretic drugs. Acute illnesses such as influenza can also increase your risk of dehydration. Fever and sore throat make you less likely to want to drink. Heavy exercisers, especially endurance athletes, are at a higher risk of dehydration because their bodies may lose more water than they are able to consume. However, dehydration is also cumulative, so you can become dehydrated over the course of a few days even with light exercise if you don't consume enough water. People in very hot climates or who are frequently exposed to prolonged heat are at higher risk. For example, construction workers and other people who work outside all day are at an elevated risk for dehydration. This is especially true if it is also humid in that climate. Sweat does not evaporate well in humid, hot environments, so your body has more trouble cooling itself. People who live at high altitudes, above 8,200 feet/2,500 meters, are at an increased risk for dehydration. Your body may resort to increased urination and rapid breathing to keep your body oxygenated, both of which contribute to dehydration. Recognize mild or moderate dehydration. You can usually treat mild to moderate dehydration at home, with the remedies suggested in this article. Common signs of mild to moderate dehydration include dark yellow or amber urine, infrequent urination, reduced sweat, increased thirst, dry mouth, nose, and eyes, skin that feels dry and tight, may be shriveled, unusually wrinkled, dizziness, feeling faint, weakness, shakiness, overheating, headache, fatigue. Recognize severe dehydration. You should not treat severe dehydration at home with remedies. You will probably need more hydration to recover from severe dehydration. Seek immediate medical attention if your symptoms include any of the following: little or no urination, very dark urine, dizziness or lightheadedness that significantly impairs your ability to stand or move, weakness or shakiness, low blood pressure, fast heart rate, fever, lethargy or confusion, seizure, shock, for example, pale, clammy skin, chest pain, diarrhea. Look for symptoms of mild to moderate dehydration in children. Children may not be able to communicate all of their symptoms to you. There are several things you can look for to help determine whether your child is dehydrated. Reduced tears. If your child is crying but not producing tears, or not as many as usual, he is dehydrated. Capillary refill time. This is a simple test often used by pediatricians to test for dehydration. Press on the child's fingernail until the nail bed turns white. Have your child hold her hand above the heart. Watch how quickly the nail bed turns pink. If takes more than 2 seconds, your child may be dehydrated. Rapid, shallow, or disturbed breathing. If your child is not breathing normally, it could be a sign that he is dehydrated. Recognize severe dehydration in infants and children. Severe dehydration in children should be treated immediately by a medical professional. Call your pediatrician or emergency medical services if your child has any of the following symptoms. Sunken eyes or fontanelle. The fontanelle is the soft spot on very young infants' heads. If it looks sunken, the baby is likely dehydrated. Skin turgor. Skin turgor is essentially how your skin snaps back after being moved. For example, children who are dehydrated will have reduced skin turgor. If you pull up a small fold of skin on the back of their hand or on their stomach and it doesn't return to its original state, the child is dehydrated. No urine output in 8 hours or more. Extreme lethargy or loss of consciousness. Check your urine. When you are adequately hydrated, your urine should be a pale, transparent yellow. Having too much or too little water in your system will change the color of your urine. If your urine is very clear or has almost no color, you may be overhydrated. Overhydration can cause dangerously low levels of sodium, a natural electrolyte your body needs to function. If your urine is dark yellow or amber, you are probably a little dehydrated and should drink water. If your urine is orange or brown, you are severely dehydrated and need medical attention immediately. Treating infants and children. Use an oral rehydration solution. This is the preferred treatment recommended by the American Academy of Pediatrics for mild to moderate dehydration. Plan to restore your child's fluid levels over the course of 3-4 hours. Use a commercial electrolyte solution such as Pedialyte. These solutions have sugar and salt electrolytes to help prevent low blood sugar. It is possible to make your own rehydration solutions, but due to the possibility of error, it is generally safer to use commercial solutions. Give your child 1-2 teaspoons, 5 to 10 milliliters, of the solution every few minutes. You can use a spoon or an oral syringe, does not contain a needle. Start off slow. Too much fluid at once can cause nausea or vomiting. If your child vomits, wait 30 minutes before starting again. Avoid other fluids. If your child is dehydrated, he will probably need to have the electrolyte balance in the bloodstream restored. Sodas and juices may cause hyponatremia, or low blood sodium, in children. Plain water also does not contain enough electrolytes to replenish your child's body because children have a much faster electrolyte turnover than adults. Sodas may also contain caffeine, which is a diuretic and can further dehydrate the child. Juices may have too much sugar and can make dehydration worse in young children. This is also true for sports drinks such as Gatorade. Other fluids to avoid include milk, clear broths, tea, ginger ale, and jello. Breastfeed an infant. If your baby is still breastfeeding, try to persuade the infant to breastfeed. This will help restore the baby's electrolyte and fluid levels and will also help further fluid loss through diarrhea. You can use oral rehydration solution in between breastfeeding if your infant is very dehydrated. Do not use formula during the rehydration period. Maintain hydration. Once your child has had the initial fluids restored, you need to make sure that the child continues to get enough fluid for the next 24 hours. The American Association of Family Physicians recommends the following formula. Infants should receive 1 ounce of oral rehydration solution per hour. Toddlers, ages 1-3, should receive 2 ounces of oral rehydration solution per hour. Older children, over 3, should receive 3 ounces of oral rehydration solution per hour. Check the child's urine. To make sure that rehydration is working, check the color of your child's urine. As with adults' urine, healthy children should have pale, Clear yellow urine. Very clear or colorless urine could be a sign of overhydration. Ease up on the fluids for a bit to make sure that you don't throw off your child's sodium balance. If the urine is amber or darker, continue with the rehydration treatment. Drink water and clear liquids in small amounts. Water is usually enough to rehydrate adults. Other options include clear broth, popsicles, jello, and sports drinks that contain electrolytes. Go slow. Drinking too much too fast may cause vomiting. Try ice chips. They dissolve slowly and the cooling effect can be helpful for overheated people. If the dehydration is the result of prolonged physical activity, consume a sports drink that contains electrolytes. Avoid some fluids. When you're dehydrated, avoid caffeine and alcohol. These have dehydrating effects on the body. Beverages such as coffee, caffeinated tea, and soda should not be taken while dehydrated. You should also avoid fruit juices, as the sugar can have a dehydrating effect by increasing urination. Eat foods with a high water content. If you are not nauseated, try eating some fruits and vegetables with a high water content. Watermelon, cantaloupe, grapefruit, oranges, and strawberries are very high in water content. Broccoli, cauliflower, cabbage, celery, cucumbers, eggplant, lettuce, sweet peppers, radishes, spinach, zucchini, and tomatoes have very high water content. Avoid dairy if you have diarrhea or nausea along with dehydration. It can make these symptoms worse.